A concussion is a traumatic brain injury that can happen when your brain is either jolted or hit from the side. It can even happen with the head not having to be hit against anything else. So even a whiplash injury can create a concussion. Concussion symptoms vary. They can become present almost immediately after impact. Sometimes it can take 24 to 48 hours. And even in some cases, on return to work or when you're starting to stress your body again, you can reproduce some of those concussion symptoms. The symptoms basically are headaches, dizziness, nausea, sometimes vomiting, difficulty with concentration, difficulty with memory, and some people even have impairment with their sleep. Either they need to sleep too much or they can't sleep at all. A concussion is a metabolic injury, and that means it affects the brain at a molecular level. So you can't actually see a concussion on an MRI or a CT scan. The reason your child or a patient is sent for an MRI or CT scan is just to rule out that there's no skull fracture or that there's no intracranial hemorrhaging or a brain bleed. There is not always loss of consciousness in a concussion. In fact, in up to 90% of cases, there is no loss of consciousness. So just because there was no loss of consciousness does not mean there is no concussion. The initial management of a concussion is very much dependent on the symptoms. So everyone can present differently with a concussion. So the best way that you can diagnose it is by seeing a sports physician, and they'll do a baseline test, they'll do a balance test, and they'll do like a cognitive or memory test. And that, in conjunction with the history, we can diagnose a concussion. Yes, concussion generally resolves on its own in 80% of cases in 10 to 14 days, so there is no treatment required. In 20% of the cases, they may present with persistent concussion symptoms. In that vein, we can treat them. So in all concussions, the recommendation is that for 24 to 48 hours, they have complete rest. So that is no TV, no cell phone, no bright lights, no noise, just resting quietly on your bed. Drinking lots of water is also a great thing. After 48 hours, there's new research to show that we should actually be getting patients more active. So that long past statement that everyone should be off on full bed rest for 2 weeks is now a misnomer, and we created a change in the protocol. So what we can do is get patients exercising at least 20 minutes a day at a sub-symptom threshold of their heart rate, and that actually improves the blood flow to the brain without stressing the brain. And that's how we get some improvement. The brain has an amazing capacity to heal. And in the way I describe it to patients is that imagine that your brain is 4 highways of information. So one highway is your somatic, which is your neck pain, your dizziness, your nausea, your headaches. Another one is your memory and your concentration. Another one is your mood, which some people get quite aggressive, some people get very depressed. The other highway is a sleep or fatigue highway. So in some cases, patients report that they cannot sleep, and sometimes they cannot stop sleeping. So how we can treat this is that I can isolate the somatic highway, and I can do treatments that work on your cardiovascular endurance, which is basically the sub-symptom threshold exercise that we discussed earlier. And the other thing is to work on their balance and their vestibular and oculomotor pathways. And that helps to improve with dizziness, nausea, sensitivity to light and sound, and headaches. When your child has a concussion, there is no reason for you to wake them up every hour. It's really important for them to sleep, as sleep is the best way for the brain to heal. But there is a disclaimer. It has to be treated or assessed first by a physician to make sure that they are happy that there is no further skull fracture or bleeding. And once they are happy, then you are welcome to let your child sleep through the night. For the first 48 hours after concussion, we are trying to stop the brain from having to do any critical thinking or problem solving. So we suggest strongly that there's no television, no TV games, no cell phone. Even things like doing a maths sum can actually load the brain and make it more fatigued. So we literally just ask them to sit very quietly. They can read a book, not a Kindle, as long as there's no backlighting. So they're able to do that if it doesn't aggravate a headache. But generally, it's just full bed rest for 48 hours. The research says that there isn't any way to prevent a concussion. A mouth guard just helps for orofacial injuries, so that is useful. And the head guard is more just to protect your skull from being fractured. But because your brain is floating in fluid, even a helmet doesn't give the same amount of support. There is some research to say that strengthening the neck will be a good help, because it's when there is a whiplash action, then there is more support of your neck muscles to almost shock absorb some of the vibrations in the brain. The best thing to do is to make sure that if you've had one concussion, to make sure you have complete resolution of symptoms before you go back into sport again, because the biggest risk of concussion is a previous concussion. The first thing to do is monitor your symptoms for the next 2 to 4 hours. If you have an increase in headache, or you start vomiting, or you get sensitive to noise or light, then I would suggest that you go and see a medical doctor at a casualty.